And so welcome. We're going to be talking about clinical and counselling psychology as a career. And I think David has really said what I've got on the next slide, which is this, that in terms of who I am and sort of where I'm coming from on this, I am indeed a consultant clinical psychologist. In fact, this is the 50th anniversary of me becoming a consultant, or not a consultant, but a clinical psychologist. I actually qualified way back. In those days, you could qualify at the tender age of 23. That's no longer possible, but that in those days was possible. And I was, again, as David mentioned, I was the clinical research director for many years of the South Wales programme in clinical psychology. And I'm still teaching, I'm still in contact with colleagues and so on. So I sort of know what's happening. And in recent months, actually, quite a lot has been happening. And there's, I think, some good news. So we're going to finish maybe on a high of saying, hey, there might be a lot of opportunities coming up, perhaps, for careers in the clinical psychology field. Okay, so let's start off. Psychology as a career, we'll sort of zoom in from a great height, as it were. You might know that psychology is the second most popular degree in the UK. About 13,000 graduates in psychology emerge each year from the universities. You know, I say it's the second most popular, so you'll be racking your brains. What is the most popular? The answer actually is business studies. But around 17% of psychology graduates then go on to become professional psychologists. So you can see, therefore, the 83% don't take that path. Some of them, many of them, I guess, never really wanted to. They just want a general psychology degree. And you know that psychology degrees are highly valued. They help people to become supernumerate. No, that's the wrong word. To become numerate and to become literate. You know, it's a degree that's well respected across the board in the civil service, etc., and so on. Okay. But of course, there are people who do go on to become clinical and other professional psychologists, which means that they need advanced training to take a higher degree or to take a diploma. There are basically academic psychologists and there are practitioner psychologists. And tonight we're going to be focusing on particular types of practitioner psychologists. Now, academic psychologists, just to sort of fill the picture, you will know, I'm sure, of course you will, through your Open University studies, you will know many academic psychologists. They engage in research and teaching, they work in colleges and universities, and the route in, typically, for an academic psychologist is that they take a psychology degree, which has got GBC. Now, we'll say what GBC is, but it's very important. And they then go on to do a PhD typically, and then go on to get a job. GBC, what's that? It's the graduate basis for chartered membership of the BPS. If you've got a degree which has got GBC, then it means the BPS will recognize you as having a psychology degree. And that's something which you need to have in order to get, for example, on a course in clinical psychology or educational psychology or whatever. So it's very important. Just to note, you don't have to be a member of the BPS, but you have to have something that they would recognize as a psychology degree. And basically, they give you the thumbs up and say, yep, you're on a pathway to be a chartered member because you've got what it takes, the first step of what it takes, which is a degree in psychology. All right, so that's very important. And some people who take a degree with some psychology in it are not actually going to be getting GBC. So that's something very important in terms of a career in psychology. So that's academic psychologists. What about practitioner psychologists? Well, these are registered to provide a service to the public, okay? And they're registered with another acronym coming up, which is an important one, which is the HCPC, all right? And I'll explain that in just a while. So practitioner psychologists then work in hospitals, they work in schools and so on, depending on what they're qualified in. And the route in typically is to have, of course, a psychology degree to start with GBC, then to go on and to go on and study on an HCPC accredited course, and then they'll get a job. Now, the HCPC accreditation is extremely important here. For example, let's take the field of forensic psychology. Some forensic psychology masters, for example, are HCPC accredited. So they are on a pathway to being a practitioner forensic psychologist. Other forensics masters are not HCPC accredited. They are academic courses, and they will qualify you maybe to teach in a university or something, but they're not a step towards becoming a practitioner psychologist. So that's really important. And a pitfall would be if you wanted to be a practitioner forensic psychologist, for example, but not knowing about the HCPC factor, then you would register on a non-accredited course. That won't happen with doctorates in clinical psychology or counselling psychology, which are all HCPC accredited. Okay. So, statutory registration is what this is all about. HCPC is the Health and Care Professions Council. And basically it is a list. If somebody, for example, if somebody wanted to see me as a psychologist for therapy, they might well look me up on the HCPC register. If I'm there, then it means I'm pucker, I'm qualified, I'm registered, I'm accredited. If I'm not on that list, then something would be wrong. I wouldn't be in a position legally, actually, to advertise myself, for example, as a clinical psychologist. That is a protected title. So you will see sometimes HCPC registered beside clinical psychologist or physiotherapist or whatever, and that means, yes, they are accredited. Okay, so that's very important. So anyone offering a service as a psychologist, a practitioner psychologist, has to be registered with the HCPC. And these include, something slipped with my graphics here, but clinical psychology, counselling psychology. These are the only 7, by the way, coming up. The only 7 recognized types of practitioner psychologists: clinical, counselling, educational, health, occupational, forensic, and sports and exercise. Okay, so those are the 7 types of practitioner psychologists. We're going to be focusing tonight on clinical and counselling. Just mentioned forensic. I've already mentioned forensic. I'll say just a word or two more about forensic, but basically that's our territory that we are going to cover. Okay, so the role of the HCPC then is that it sets standards. It sets generic standards for all practitioners, but also specific standards for each discipline. Standards in terms of conduct, in terms of performance, and in terms of ethics. And it maintains these standards in 2 ways. One, through accrediting training courses. So if any university wants to develop and mount and offer a course on, let's say, counselling psychology or forensic psychology or whatever, a practitioner one, then they will have to apply for and be given HCPC accreditation, and that's a long business, lots of paperwork, lots of on-site visits and the rest of it. And then if HCPC gives the thumbs up, then they can advertise the course and offer the course as an accredited HCPC course. The other thing is that it does to maintain standards is by enforcing conduct and ethics with individuals. So basically, if you're on the HCPC register, you're on a list that you can be struck off. basically. And if you do something, if somebody, a client accuses you of something or whatever, then there will be a hearing, and if it goes against you, it would mean that you're struck off and no longer able to practice. Okay, so HCPC accredited courses include some master's courses, 1 or 2 years full-time or longer for part-time, taught doctorates, 3 to 6 years full-time or part-time. I'll say right away that all clinical courses are full-time only. There are no part-time clinical courses. We'll say more about that. And beware, well, I've already said this, to gain practitioner status, the course needs to be accredited by the HCPC, and some courses are not. So beware, beware. But all UK doctorates in clinical and counselling psychology are HCPC accredited. Okay, so as long as it's a doctorate, and I'll say something else, not just the doctorates, but as long as it's a doctorate in one of those areas, you can guarantee that it's HCPC accredited. Okay. So practitioner doctorates, and that's really mainly what we're going to be talking about tonight. They are all taught doctorates. There are also, of course, PhDs, research-only PhDs, and a research PhD is not HCPC accredited for practitioner qualification, or indeed for anything else. So HCPC is only about practitioner qualifications. Okay. So there we are, that's the introduction, and now let's talk about clinical psychology. We'll then go on to counselling psychology. Okay, so clinical psychologists, as I'm sure you know, aim to reduce psychological distress and to enhance well-being, to promote psychological well-being. They work with people, clinical psychologists, with people who have mental health problems, but also physical health problems. So a lot of clinical psychologists work in, for example, in cancer care, in post-stroke, and in dermatology or diabetes and so on. So it's not just mental health. And the important thing to say, and I'll be saying it a number of times, is that clinical psychology training is generic. Yeah, you can't train as a child clinical psychologist, right? If you're a clinical psychologist, you are entitled to work with children and families and older adults and working age adults and with people with learning disability. It's generic. It covers the whole range. All right. So physical and mental health problems, for example, of course, anxiety and depression, also serious and enduring mental illness. That's the sort of term that is used, and it covers psychosis, it covers bipolar, it covers, we're talking about enduring mental illnesses which are severe in nature and so on. And then also adjustment to physical illness, and of course the list goes on. So we're including also neurological disorders, which includes degenerative disorders, the Alzheimer's and other dementias, head injury, stroke, and so on, eating disorders also, and addictive behaviours, but we go on as well. Childhood behaviour disorders are covered, family relationship problems, learning disability, that whole field, and also forensic, in the sense that there are some clinical psychologists who will be working in medium and high secure prisons and delivering therapy in that setting. So a very wide range of specialties, but the specialties come after you've qualified. You then choose with which client group you want to work, but your training covers all of this. There will be placements which will cover basically the whole territory. So it's a generic training. Okay. In the UK, of course, most clinical psychologists work within the NHS. That's 95% of newly qualified clinical psychologists go into the NHS. Indeed, the NHS is paying for the training, and we'll come on to those details. And in a sense, there is an expectation that you will work certainly with NHS clients and so on. But there's no compunction to do that. So if you wanted to set up privately, for example, then you would be entitled to do that, but it's not the thing that most people do or want to do, at least initially. And clinical psychologists generally work, of course, in healthcare settings and social care settings. The social care, by the way, is mostly with people with learning disability, and these settings include hospitals, health centres, CMHTs, community mental health teams, which are secondary care in the community, and CAMS services, which are child and adolescent mental health services, and also, as I say, social services, which is mostly learning disability. They generally work within a multidisciplinary team. For example, I worked in a community mental health team, and there were in this team psychiatrists, psychiatric nurses, social workers, OTs, occupational therapists, and so on. All right, so a multidisciplinary team, which would typically in that sort of setting meet weekly all together to discuss particular clients from different perspectives, and we're bringing different expertise into the room. Okay. Most clinical psychologists work with a particular client group post-qualification. So, and the four sort of main groupings are adult mental health, child and family, learning disabilities, and older adults. And in training, every trainee, and that's how they're titled rather than students, each trainee works for 6 months in a placement, one adult mental health placement for 6 months, a child and family for 6 months, learning disability, and older adults. So that adds together to 2 years, and in the 3rd year they then do what's called an elective placement, where they choose a particular specialty. So if they were particularly interested in, let's say, eating disorders or in stroke rehabilitation, then they would hope to do their final year in that particular setting. Which might mean that they then go on for their first qualified career move into that similar specialty, but they might not. Again, there's no necessity for that. Good. Okay. So going further on, typical work activities of clinical psychologists include assessment, including psychometric tests, assessing clients' needs, their abilities, but not only tests, but clinical interviews, very special skill of conducting a clinical interview, and also in some cases behavioural observation is quite important. Also, what we aim to do is to gather lots of information across the biological, the psychological, and the social domains in order to generate a formulation of the client's problem, a sort of theory really about where they've come from, where they are now, and where they might go. So a formulation is an ever evolving. As you learn more information, you change the formulation, and that, of course, that formulation will give you guidelines to where you would go in terms of intervention, in terms of therapy. And then, of course, devising and implementing treatment programs. So therapy is obviously a very important part of almost all clinical psychologists' enterprise, but it's not the only thing. Assessment, formulation, and it goes on as well. There are other things that clinical psychologists do, including, here we go, providing consultation to other professions, which is quite important, and also training other professional groups. So there's a lot of that sort of extra activity that takes place. And also, finally, last but not least, is carrying out applied research to try and, well, to learn, to increase the evidence base, to learn more, because clinical practice is, is evidenced by research. So you know a lot of research, and you draw upon this in your clinical practice. So, clinical psychology orientation, the general orientation is biopsychosocial, and those of you who've done SDK will know all about the biopsychosocial model, and absolutely that is the working model of almost all clinical psychologists. acknowledging the importance of biological factors, brain processes, of sleep and nutrition and all of that, but also obviously psychological and also social context and so on. And in addition to the basic biopsychosocial approach or orientation, there's a recognition of systemic principles. And that's systemic in the sense that being part of a family, being part of a community, is very important in terms of an individual's experience and an individual's often individual's problems or an individual's resources for getting away from problems, and particularly for recovery. The orientation is also that of a scientist practitioner. Okay, so clinical psychologists think of themselves as, yes, drawing on the science, as a term we've heard a lot lately, but using the science to inform their practice. So practice is evidence-based. Okay, that brings up all the psychology that you will have learned through your undergraduate and your postgraduate and your extra reading and so on. So you're knowledgeable based on the science of psychology, and you draw upon that in helping people in your practice, but also not only scientist practitioner, but also reflective practitioner. So that means that you think about your practice, you reflect on it, you don't just let it go by, you think about what you did, you think about planning what you're going to do next, and so on. So those two orientations, both of which are seen as essential. Right. The main therapeutic orientation for most working clinical psychologists, qualified clinical psychologists, is cognitive behavioral, CBT. And there are so many variations now on CBT, including mindfulness-informed CBT. When I started off, it was first generation, as it's now called, which is behavior therapy, and then became much more cognitive. And these days we talk about third wave CBT, which includes such things as dialectical behavior therapy and acceptance and commitment therapy and mindfulness-based CBT and so on and so forth. But the main orientation for most clinical psychologists is some variation of CBT. But also there are some who specialize in, say, family therapy as an approach, which would be systemic, and all courses, well, this is it. In terms of, I talked about the orientation of qualified clinical psychologists, but in terms of training, there will be a huge dose of CBT, because all courses, by ruling of the HCPC, and you know how important that is, all courses have to provide training in CBT and one other evidence-based therapy. And some courses actually sort of take that with a broad definition, and they do CBT, and the other one would be something like DBT or ACT, acceptance and commitment therapy. So it's a sort of double dose of CBT, but there will usually be some systemic and some training in other areas as well. But CBT is the main orientation. There are some courses which have an interest in psychodynamic, psychoanalytic approaches, but those are certainly in the minority. Right, the typical pathway then to becoming a clinical psychologist is this. You have a good degree. GBC, I don't need to tell you about that anymore, but it needs to be a degree in psychology, which is recognized. Good means here a 2-1 or above, right? That would be something which these days would be essential in many courses. We'll come to this point, but actually some time ago, if you had a 2-2, but then you did a master's, that would sort of wipe out the 2-2, and now you're a master's, and now you can apply for a doctorate. These days, some of the courses are being very fussy and saying, no, if you've got a 2-2, I'm afraid you don't come onto this course, even if you've got a master's afterwards. Okay, there are guides as to which which courses have those different rules. Then you go on to, and that arrow should have been in the middle, but nevertheless, you go on to become to get some experience as a psychology assistant. or as an IAPT practitioner. And I'm going to be talking about IAPT later. So for now, if you don't know what IAPT is, just leave that for a second, okay? So you're employed or indeed volunteer as a psychology assistant, or you're employed as an IAPT practitioner, or the other way of doing this is to actually do postgraduate research. And you may be surprised that quite a few people who apply for the practitioner doctorate actually already have a PhD. That's probably about 10% these days, okay? So that's another way of doing it. But really, you need more than, you know, as it were, your first degree. And certainly, as I'll say, applying, as it were, in the last year of doing your degree without any experience in the clinical field, really there's very little chance, in fact, no chance, I would say, that you will be accepted. Okay. Then you go on to the next step, which is the qualifying step, which is a 3-year clinical doctorate on an HCPC, of course, approved course. It's a generic training. I've already talked about that. And the good news is that if you get onto a course, that you are, as a trainee, you are employed by the NHS on a fairly decent salary as a trainee clinical psychologist. So, you know, if you get accepted onto a course, what goes with that is a job, the job of being a trainee clinical psychologist with a salary. So clinical psychology, I'm going to look at some of the good news and some of the bad news, and then look to the future. And the vision of the future is changing as we speak, really. So we'll come on to that as well. But first of all, some good news. Right. The good news is includes this, that traditionally there are many posts. There aren't sort of unemployed clinical psychologists, all right? You won't be out of a job. There are always vacancies, and indeed something that's very attractive is that the work patterns in the NHS and in clinical psychology very flexible. My career was I qualified as a clinical psychologist. I then went back to university, did a PhD, and worked for 30 years in an academic setting while doing a little bit of clinical work, but basically I was an academic. And then I then decided after 30 years I wanted to work in the NHS, training clinical psychologists, which I did. And when I got that job, they said, how many sessions do you want to work? And I didn't know this notion. I'd had a full-time job. You know, as far as I was concerned, a job was a job, but not in the NHS. And I could choose how many sessions, a session being a half day. So a full week is therefore 10 sessions, but a lot of people work maybe only 8 sessions, or some only 6 sessions. I'll come on a little bit more about the flexibility of this, but it's very attractive in many ways. The salary scales, just to give you a sort of idea of which of the sort of territory that we're in, is that, and some of you probably work in the NHS or have partners or friends who do, and you'll know that the salaries in the NHS go by bands. They go up from band 1 up to band 9. And a trainee clinical psychologist is on band 6. And that salary is, they start at 31,000 while they're training, and of course all their fees are paid for their doctorate, and travel is paid and all the rest of it. So it's not bad, and that would then go up a little bit each year of the 3 years and so on. Now I've got the note bursts in there, which is short for bursary, and there's always been this sort of threat, really, that salary could be taken away, and instead trainees could be given bursaries of only about 8,000 to 9,000 a year, sort of to live on. That threat has been almost lifted now by a statement just a couple of months ago by Health Education England, saying that they are not going to adopt a bursary approach. So it looks as if those trainee salaries quite safe. Then when you qualify, you'd be on a band 7 at 38 to 44k a year, and then thereafter you'd be a band 8 and that will take you from 45. So you'd probably qualify and be 3 or 4 years maybe as a band 7, and then after that a band 8, and you'll see that that's a huge and certainly not everybody. It's not an automatic. There are 4 band 8, 8A, 8B, 8C, and 8D, and 8Ds are quite rare, and that's the one that takes you up to 87. And there is an almost legendary as well band 9, which is service manager, which can take you up to 105k a year. Those are rare as hen's teeth. And in fact, they're becoming even rarer. So that's not. I guess most people in mid to end career would be on about 60, 65, 70 maybe k a year. So that's the ballpark figure in terms of salaries. And the good news there, obviously, is that as a trainee, you are paid a fairly substantial salary. That does not apply to counselling psychology, as we'll see later. Okay. More good news. Well, it's good news if you're a woman. That's 66% of clinical psychologists, and actually 85% of people coming into the profession are women. And the other piece of good news is, of course, that this is a very rewarding career. It's really got such a lot going for it. It's working with interesting people, interesting colleagues, interesting clients, and you really choose your specialty, and you don't even have to stay in your specialty, your initial specialty. You can move around a bit, or you can have a split post. So there are people I know who have 4 sessions a week. That's 2 days with one specialty, and they have 6 sessions in another specialty, and nobody blinks an eye about that. That's a perfectly respectable thing to do. So that flexibility is particularly attractive for some people. Okay. There are many different specialisms, many different work settings, work contexts, very flexible work schedules. For example, the session base that I've already explained. Also, there are school-friendly contracts, which means that that's a contract where you start at 9:30 and you finish at 3 o'clock, and only in term time. You don't work out of term time, so you can see how school-friendly and family-friendly that option is. Then the bad news, I'm afraid, and the bad news really is there's one piece of bad news, which is it's very difficult to get in. If we look at the year and the places and the percent that were successful in 2015, 2016, 2017, it's not really much difference here. We're talking about 600 a year of places, plus or minus a few, and the success rate is 16% every year. It's really not changed. I could have gone back another 10 years before that, and it's been absolutely stable. And that's not a lot when you think only 600, that's over the UK, so only 600 people qualifying as a clinical psychologist every year. And there's probably 700 people retiring, so it's not adding to the relevant workforce. Apologize about the squiggly layout there. It was perfect in my copy, as they say. There we are. But see later, because there is some good news coming up, which is that there has been a recent announcement of increases and some other things as well. So even the bad news is now tinged with some good, but it is still, nevertheless, there are a lot of people. I think the next slide is just a graphical display of that. So in 2019, over 4,000 people applied and 600 got places across the UK. That's the bad news. And there we are. That's just the same as I've already given you. 4,000. That's from last year. 50,000. Sorry, 50,000. 4,000 applicants, 614 places. 15%. So we'll be thinking later about what can you do to increase your chances of being one of the 15%. Okay. So there's more good news, by the way, which is about attrition, and this is incredible, actually. that over the past 5 years, on each year, the attrition rate, that means people who start but don't finish, is less than 1%. Less than 1%. I think in teaching, it's something like 15 to 20% don't complete a course. And I know that in nursing, in some areas, it's 30% don't complete the course, don't qualify. Whereas here, it's less than 1%. So 600 start and 595 finish. And 5 includes some people who drop out for various reasons and some people who fail. Failing is very, very rare, as you can see from this. And that might make it sound as if it's a cinch, it's dead easy. It's not. So many people come close to failing, right? But they don't fail because there's all sorts of rescue and support and all the rest of it, because, you know, it's such an investment in people that we don't want to lose people in their second or third year. That would be such a lot. It costs overall, you know, well over 100,000, much more than 100,000 to train a clinical psychologist. We don't want to lose people. And the selection procedure, of course, is also, that's a testament to how good the selection procedure is. Indeed, the sad news is that there are a lot of people who could have been selected who don't get selected because there just aren't enough places. And we regretfully have to say, sorry, we can't take you. We'd love to have you, but we can't take you. Okay, right. Looking at the time, I'm just going to speed up a little bit here. Right, the training courses, there are 30 across the UK, and all applications are handled by a clearinghouse, which is based at Leeds University, just happens to be based at Leeds University. The clearinghouse is very important. The applications are rather like UCAS. You apply for 4 courses and so on, up to 4. If you want to find out more information about any course or where the courses are or how many each of them takes, any of that, and what their orientation is, it's a vast amount of information, and you can get it simply by Googling Clearing Psychology Leeds, and that will give you all of that. That will then, the top hit on that Google will give you the Leeds Clearinghouse in Clinical Psychology. Applications then are, the deadline is always the end of November for the next September, for the next year. If you apply, you have to pay an application fee of just £24. And then you go to an online completion of an application form, and it's pretty substantial. It needs to be very carefully completed, and you specify up to 4 course centres. And if you know, it's wise to actually go for all 4, you know, and show that you're prepared to travel, for example, rather than I live in Manchester and I'm not going anywhere else, so I'm only applying for Manchester. That would look bad. It would look as if you weren't that motivated, as it were. Okay. And they're non-ranked, by the way. So if you put 4 in, I think it's in alphabetical order or something. Right, applications, all 30 UK courses are 3-year full-time. Right, there's no exception to that. Always 3 years, always full-time. All of them are taught doctorates and usually called a D-Clin-Sci, not a PhD, but a D-Clin-Sci, doctorate of clinical psychology. But with that, then you're Dr. Smith, Dr. Jones, or whatever. Okay. There's then an extensive shortlisting procedure. About 6 people will look independently at your application and will rank and rate and all the rest of it. And then all of that data will be put together and come up with a shortlist. Some courses now use an online test as their first sift. Okay, so look at that in terms of the clearinghouse, whether you feel that, you know, that was something that'll tell you the nature of the online test and so on. So you'll be able to think about that. And then the people who eventually are shortlisted are interviewed. Typically, I think there has to be a 4-to-1 ratio. So if you have 20 places, you would have to interview 80 people. And the interviews are held in March and May for a September start. Referees are very important, of course. Applicants nominate both an academic referee and an experienced referee. Typically, that would be somebody who has supervised you in a clinical job as an assistant. And unless the experienced referee is the current employer, you must explain, how does this person know you? How do you know this person? And the clearinghouse then contacts referees via their email address, which you give, and so on. Okay. Selection procedure. There are typically two panels so you visit the place um, and you then have interviews, two interviews, one with the academic panel and one with the personal and professional panel. Typically there would be 4 people on each, and the panels would include course staff, not surprisingly. Trainees would actually be interviewing you as well, and they would get equal vote with the course staff. Also other clinical psychologists from the region, and also service users and carers. And again, that's something which is not surprising in the context of how these courses operate. That the service users and carers of service users are very much part of the overall training of the clinical psychologists, the trainees, and they have again equal vote power within the selection. So if a service user says, I would like that person to be my therapist, well, that will be something that will count quite heavily in a not very positive way. Course intake then, average for courses is 20 trainees a year. The small ones like Bangor in North Wales, Essex and Coventry Warwick, that's one joint, Coventry Warwick. And the largest one is actually University College London, which takes 42. Now, you might think, oh, I'll go for that one then, because that's the most places, that'll be the most chances. But not surprisingly, about 4 times as many people apply to UCL as do to Essex and Bangor and so on, for obvious reasons. Okay. Right, a profile of trainees entering clinical training courses. I'm going to go quickly through this. Qualifications, well, 9% have a PhD. This is the, right, 42% have a master's, right? If somebody had a master's and then a PhD, they wouldn't be in the master's data there, they'd be in the PhD, so it's as high as you go, as it were. 20% have a first, but not a master's or a PhD. 30% have a 2-1. And 4% have a conversion or a diploma, right? Which is, of course, has to be BPS accredited, this thing. And then the last one is that 0% have a 2-2 only. Okay, so some of the people with masters will have had a 2-2 maybe, but nobody, as it were, has been in for the last 5 years with just a 2-2 and experience. Okay. Undergraduate applications, well, basically forget it. I should have said something, but there we are. Successful applications, exceptionally rare, average of less than 1 per year for the past 10 years. And those are the people who've been, mental health nurses for a lot of time and so on, and then been in the last year also of an undergraduate degree in psychology. Maybe with the OU, we on our course had 1 or 2 of those people. By the way, just to say, some more good news is that people with an OU degree are well regarded. Okay, because they often have a lot of life experience, which is highly relevant as well. Other characteristics, right? Permanent residence in the UK is 100%. This is being paid for by the NHS. Self-funding, tiny. We'll come on to that on the next slide. Don't hold your breath. It's not easy. The age of those accepted, people will be interested in this, I think. Not surprisingly, the vast majority are in their 20s. The average age of acceptance is probably 26, 27. 16% are in their 30s. And 2% actually in their 40s. And there has over time been the odd, exceptional person who's been accepted and they've been in their early 50s. But you can imagine that, their career is going to be rather curtailed when they qualify and so on. Okay. And then the other thing, gender, and I've already mentioned it, 85% are female going in and 15% male. Right. Self-funding, I'll just say a word about this. Fee paying, there are a few courses now that offer a few places, but only about 12 places in total across the 30 courses, and the fees are very high. I mean, look at that, 25,000 a year. Plus you've got to live. That's the fees, right? You've got to live. You've got to pay for your own travel and everything else. You get nothing other than that, as it were. So travel, placements, and so on. It's worth saying that in your placements, for example, they might be quite a way away. Certainly in the course that I was on, the Wales course, the South Wales course, you could have, placements which would be 100, 120 miles away, and you'd be there 3 days a week, so you'd have to stay there overnight. Now, if you're a trainee, if you're employed, then of course all those expenses are covered. But if you're self-employed, they are self-funding rather, they are not. So at the same time, there's a lot about widening access. So we're charging huge fees and all the rest of it, and so difficult to get in. And yet there's a major emphasis on widening access, on equal opportunities. And this has been stressed again very recently. We need more people, and it doesn't matter. And here's a statement recently: we welcome applications from people from ethnic minority backgrounds, people with disabilities, and men, as these groups are currently underrepresented. Okay, there we are. And there was the 2-tick system, which some courses operated for a while, and they still partially, maybe some courses partially. And the 2 ticks means this: if you've got the minimum qualifications, right, psychology degree and some experience, and you have a disability, then you're guaranteed an interview. The problem with that was that they didn't have to say what the disability was. You didn't have to be registered disabled. And suddenly we had lots and lots of people who had to be interviewed, and it just became, and some of those people really, were not strong in terms of their case. Most people who get interviewed are very strong in terms of their case for being admitted to a course and being trained. Okay. Training then is generic, as I've said. Oops, let me just go back on that, but really I'm trying to rush a bit. It's 4 core modules, which I've talked about, for 6 months each, also an elective placement in the 3rd year. Approximately 60 clinical days on each placement, which can be distant. I've talked about how far away it can be. So that can be difficult for some people. 1 or 2 days then academic training, teaching in the university each week. And then assessment, well, there are essays and case studies. There's a small survey or service evaluation, a large-scale doctoral project and thesis. So you're doing a doctorate by research, collecting your data, writing it up, having your viva with external examiners and all the rest of it, in addition to all this, very heavily loaded. It's a very full-on, full-time course. And 5 clinical placement assessments of clinical competence. And by the way, if you fail one of those, you have to do the whole placement again. So another 6 months is added, for which you would actually be paid. Right, counselling psychology, and I'm so sorry that just time is running away, and I want to have some time for questions. So apologies to those people who are primarily interested in counselling psychology, but I'll have to just speed it up. Counselling psychology is linked to other professions, including counselling, which it differs from. Not everybody knows that counselling and counselling psychology are quite different. What's the main difference in terms of access is that you can do a counselling diploma or master's or whatever with any degree, but as counselling psychology, you must have a degree in psychology, of course, which the BPS approves of. Okay, so it's linked to the professions of psychotherapy, counselling, and clinical psychology. It focuses on beliefs and relationships and so on. It's informed by the scientific approach, but also by humanistic perspectives, and it draws on psychological theories more than counsellors. So counselling psychology really draws on the psychological knowledge base, but also an emphasis on reflective practice and the therapeutic relationship, which is the same as with counselling. The relationship between the therapist and the client is extremely important. There are 2 routes to training. There are university doctorates, 14, which lead to a doctorate in counselling psychology, which is a DCOP. And there's also an independent route through the BPS, and that's a QCOP. Now, the QCOP, the qualification in counselling psychology, gives you access to, well, you get HCPC recognition, you can work within the health service, everything else. It's just not a doctorate. You don't end up as Dr. Jones, but Ms. Jones. University doctorates then are, some are only full-time, 3 years, some allow part-time. No part-time clinical, but part-time counselling psychology is possible. There's a good deal of variation in approach and content, and more than I can go through. So, but the university, go to the BPS. BPS on all of this, their website is a fund of information. There are 14 HCPC accredited doctorates. Let me, sorry, I will just show you where they are. If I can go back, there they are. Right, just have a quick look, which would be the nearest one to you, and so on. So there's one in Wales, there's a few in England, quite a few in England, mostly in London, and 2 in Scotland, 1 in Scotland. There we go. Right. Then university doctorates fees, because you have to pay. Such a difference between counselling psychology doctorate and clinical psychology doctorate. So, you know, that's a really, I would have said, unsustainable difference, but it's been around forever, for 20 years or not, well, 15 years. Right, the fees are this, UK full-time 3 years, it would be 6 to 8 per annum. But you also have to pay on top of that supervision fees and lots of other things, I'm afraid. Part-time, it's slightly lower, but then it goes on for more years. International, it goes up really quite a bit, as you might expect. But the independent route then through the BPS, it's not a course of study. You don't attend lectures, or there aren't set textbooks or anything like that. There's no central provision. What you do instead, it's called a flexible training option. You identify training experiences locally to where you live that will help you to develop the relevant competencies. So you basically then have to get your training from bits and pieces, really, from other courses being offered in other universities. But they have to be approved by the BPS as, yes, this will go towards, this will be acceptable as part of your training. So, and the route for doing this, you plan it out, and it must be approved by the BPS, basically. You also have a coordinating supervisor who arranges placements and so on, and you'll engage in counselling regularly, but with clinical supervision, which you have to pay for. There's also a research project with a research supervisor, again BPS approved. It's a doctoral level award, but not a doctorate, but it does have HCPC. You can also bring in APL, which is accredited prior learning. So if you've had years of working as a counsellor, that might be relevant in accelerating your counselling psychology acceptable hours of practice, which has to be, by the way, 500 hours. So the assessment then, documented therapeutic practice of over 500 hours, and each 8 hours of therapeutic work you do, you have to have an hour of supervision, for which you pay probably about £60 to £100 an hour. And it has to cover over 2 different therapeutic approaches, and has to be with individuals, but also with one of couples or families or groups. You have to undergo personal therapy, at least 40 hours of that, for which again you have to pay at the sort of rates that I talked about. You also do an essay, a case study, 3 academic papers, examination and research dissertation, and then you have an oral examination of viva voce, which reviews everything. So it's not just your research, but also your clinical practice, your essay, your academic papers, and so on. The fees for the BPS qualification are actually just one fee, not an annual fee, and it's just under 7,000, which sounds cheap, absolutely, but when you consider that you'll have to pay for all the BIT university courses and the supervision and so on, you're talking about something which one person who was doing it said to me, it's more costly than anything else. It's more costly than any other option as it happens. So there we are. Courses that count towards the training will have university fees. Okay. But employment, well, many counselling psychologists do work privately, but many work in the NHS with the flexible work patterns and all the benefits. Once you're qualified there, as a counselling psychologist, there's no difference between you and clinical psychologists in terms of, for example, salary scales. Okay, so a qualified, therefore, counselling psychologist is on 38 to 44 thousand a year as band 7, thereafter band 8, and indeed you could become a service manager, and there are such people. Somebody I know very well is a service manager, but qualified as a counselling psychologist, and so on. So there we are. There's that's another option. If we compare them, I'm not going to go on this, but there are overlaps and differences. I think this is important, that relatively few counselling psychologists work in neurological areas or learning disabilities or forensic settings. So they mostly work with adults or children or families, okay? They often work using a more psychodynamic orientation. So that's something which is slightly different. Common competencies, well, there we go. These are the competencies that you have to achieve: the interviewing skills, the assessment, formulation, therapy skills, but also professional and research skills. Forensic psychology in one slide, you can do a doctorate or MSc, can be practitioner, but can be just academic. Be careful there, don't do the wrong one, as it were. Also just interesting, University of Birmingham's got a 4-year doctorate, which is actually qualifies you in clinical and forensic, both of those. And you can see the BPS website for details of forensic psychology if you want to, if you're interested in that. And then IAPT, I've said I'd mention it. It's short for, if you don't know it, increased access to psychological therapies. It offers a possible alternative career as a psychological therapist, not as a clinical psychologist. It's been around for 13 years now and provides therapy for people with mild to moderate psychological conditions, not for people with severe and enduring. And it targets now 1.5 million adults in per year, and as it says at the top, that is England. Unfortunately, I'm in Wales, and we don't have it in Wales. They don't have it in Scotland or Northern Ireland. IAPT is England. There are 2 main types of therapists: psychological well-being practitioners, PWPs as they're called. They are employed by the NHS. They're on band 5 to 6. There's the salary scale. They are also paid while they're training. Their band is band 4 for that, so it's less while they're training. But the good news is that they are trained and paid to be trained, and then emerge as psychological well-being practitioners. Many of those are psychology graduates who want to be a clinical psychologist and are using this as a step towards. And many people who get in have a history as a PWP, but some people, that's their career. They're happy. That's what they want to do. And then there are also the HITs, the high intensity CBT therapists. They are on a slightly higher band 7. And again, they are trained and they have a salary while they're being trained, but it's less than that. Right, and now the latest. We're finishing with the breaking news, which is this. Health Education England, but I believe that similar things to this are happening I know in Wales, and I think in Scotland and Northern Ireland as well, recently announced, and it's only weeks ago, a 25% increase in clinical doctorate places in 2020, this year, so starting in September. And by that time, and it's an extra 140 places, okay, that's in England. So it's really quite significant, that, and it's and they've said some interesting things. They spoke of an urgent need to increase access to psychological services, which will require a significant growth in the workforce. Yeah, And they also acknowledge the need to increase diversity, the diversity of new entrants. And they say we're considering implementing additional new roles in the psychological professions. So another layer of being working clinically, working as a psychologist, but not in addition to being a clinical psychologist, right? So another layer, which would be at a lower band, I presume. And considering whether psychologically informed roles might be introduced at graduate or non-graduate level. So that's a real diversification. This is new ground. It's often been spoken about, but it's never, and this term particularly, clinical associate psychologists. That term has been proposed for some years, but it's never really seen the light of day. And now Health Education England are considering it, right? This would be, they suggest maybe, it's all question marks, we're going into the fuzzy, what might be now, but 1.5 year apprenticeship. So it'd be an apprenticeship model rather than a sort of university-based training, well, probably an element of that. It's about assessment, it's about formulation, it's about therapy, and the idea is it would probably be on a band 6. And again, there would be a trainee stage, and that would be at a lower band. Okay. What can you do to increase your chances? Give me 2 minutes, I'll finish this. Right, increasing your chances. Well, show interest and commitment to support work. You know, if you've got your work as a volunteer with people with learning disability or with older adults or something, show that interest, that real interest and commitment. Become a BPS student subscriber. It's really cheap. You get into the swim of things. You get the monthly, magazine, as it were, which will, give you the debates going on and some articles and all the rest of it. It'll bring you into that sort of professional realm. Because the most, professional psychologists would be reading that same monthly magazine. Get clinical experience somewhere. That's really going to increase your chances. It might be that it'll be as a volunteer part-time for a while, and maybe then there'll be an opening and so on. It's really difficult for people who are in jobs with salaries now. Yeah, how do you get clinical experience? Do you take a day off and work voluntarily and lose that proportion of your salary and so on? Gain experience across specialties. Don't just stay with if you're as an assistant psychologist, don't be sort of 4 years working in a group with stroke patients. Spend 1 year as that and then work with children and then work and so on. Gain experience across the broad range. Become aware of professional issues. What are the debates these days that are going on in clinical psychology? What's the jargon? What's the terminology? What are the issues? Become aware of that. And of course, work towards excellent references. I may often say, if you can get to work as an assistant with a clinical psychologist who then writes you a reference saying, she's wonderful, please train her and send her back as a qualified clinical psychologist, as a colleague for me. She's absolutely the right stuff. That's the best, that's the best reference you could possibly get, but difficult to get access to that sort of opportunity. Okay, so there we go. And you must have, I do emphasize this as well, you must have a plan B. Your heart might be set on being a clinical psychologist or a counselling psychologist, but it might not happen. What would you do then? What would be your plan B? But don't lose hope, because anything can happen, as this next slide shows. There we are. Anything is possible. It could be you. Oh, no, hang on. It could be you, and good luck.
That's fantastic, Neil. That's
what I have to say. So I look forward to a few questions. I hope we have
great.
time.
I think the number of questions that have come up in the chat box has been more than we could probably hold in the same amount of time again, and I'm sure that people have even more that they haven't asked. One that I did say I would come back to was the first that was asked, which was kind of a crossover question of whether you think it's helpful to work as a counsellor while training to become a clinical psychologist. So I would chuck that one in there, but then I think if I let you take a look through the chat box, a number of the questions have already been answered. So if people want to re-ask, we'll set a limit of kind of 10-15 minutes, and I'll control the timing, But otherwise, I'll leave it up to you on that.
Okay, or if you spot something, you might have been reading the chat. I wasn't reading the chat as we went through. I mean, I can go and search for questions, but let's. But your question, or the question that you quoted there, yes, it would. Anything that has got contact with clients. Now, you say working as a counsellor. If you are a qualified counsellor and entitled to do that, if you're BAC accredited or whatever, then fair enough. And yes, any clinical experience that you can get will be absolutely valuable. Yes, indeed so. I've got one here from Alison. It's just one of the last ones to come in. So can someone with a first-class psychology degree practice counselling without actually doing a doctorate? Well, now, let's be careful about this. We're not talking about counselling. We're talking about counselling psychology. And the answer is no, you can't be a counselling psychologist without a doctorate or the BPS qualification, which is equivalent. But counselling, that's a different area. That's not seen as psychology, as it were. The BPS has no, for example, and indeed the HCPC has no legislation, as it were, over, or not, whatever the word would be, over counselling. That's a different ball game, different acronyms, different and so on. So and now I'm not sure if that's the answer to that one. Alison says, coming back, I thought that could be a plan B if I couldn't do counselling psychology doctorate. Oh, absolutely. Oh, yes, indeed. You can say, well, I'm not going to be a counselling psychologist. I can't afford it or whatever. So I'll be a counsellor. Absolutely. I mean, if you wanted to work within the NHS, probably counselling psychology. Well, certainly you can see the banding and so on. I do have a rather cheeky answer when somebody says, what's the difference between a counsellor and a counselling psychologist? It's not a very nice answer. I say it's probably about £40 an hour. But
which way is
see
that,
what I mean.
Neil? Is that
there is a difference in what people charge and so on. Good point. I know your wife's a counsellor. That's probably why you're asking. You want to put her rates there. Good. One question Hannah says. One question I have: if a master's came out as a 2-2, is it better to do another master's? And my undergrad is 2-2. Oh, that's a difficult one. I didn't know that masters were graded in quite that way, actually. Yeah, I think what you're looking to do in a master's, if you have a 2-2 undergraduate, is to wipe out the 2-2 by getting a master's that isn't a 2-2, as it were. So I think, unfortunately, the answer might be sign on for another master's. There we go. Anne-Marie says, if you have a BPS accredited BSc, does the MSc need to be accredited? No, MSCs are not accredited. It's only undergraduate degrees and doctorates that are accredited. And the doctorate here, we're talking about accreditation by the HCPC. The OU run an MSc Mental Health Science that sounds very interesting, but would it be less helpful than a traditional psychology MSc? No, I think I don't. I think courses at DClinSci courses would probably look favourably on an MSc Mental Health Science. They quite like actually people.
There've been
do
quite a
MScs
few questions,
in, research methods
Neil.
as well,
Just to
actually.
group a few up
Yeah.
from people who've
Sarah,
qualified later in life and who are in their late 30s, 40s, 50s, really asking if there's any point in going in the direction of DClinSci.
well, I gave the relevant sort of figures, and I don't know what number of people applied in those age brackets. So I don't know whether you are less likely. I mean, certainly there is no rule that says that you can't apply at any age at all. There is no age discrimination. But I think, there's probably an unwritten thing. Well, if you were in your mid 50s and you were to qualify at 58, how many years of active work? It might only be, if you work to 70, it would only be 12. But there's nothing, there's no rule that says that you can't
Mm.
apply. And if you can sell yourself, you get to an interview and sell yourself. That would be good. Um, okay. Somebody, guest 3, says, I'm on the OU BSc Psychology with counselling degree and plan to train and work as a counsellor. I'm assuming, this is me now, I'm assuming that the BSc Psychology with Counselling is a BPS approved, accredited thing. It would be, I'm sure. Would I be best to do a master's as training for counselling job, or a better chance of gaining a doctorate place for counselling psychology later on? I don't really understand that. I mean, it would be too early probably for you to apply now for counselling psychology. So the master's as counselling and the experience of then counselling for some 1 or 2 years would make you in a very good position to actually then apply to the doctorate in
Mm.
counselling psychology. So that sounds like a pathway there. Okay. Right. Is there a guide that outlines the type of questions we would face during the DCLIN Psy interview? I am told that there is lots of information if you Google the right words. They will tell you what they did last year. I mean, you know, people who went through the interview last year will spill the beans. Have there been applicants with transferable experience, support work, that have managed to gain a place without the clinical experience? Transferable experience support work. Well, it would count something, but probably not at all the experience with a clinical psychologist supervising you. So there's a gradation. Everything would help a bit, but you know, in this area, even if you say something's going to double your chances, it might just be that it doubles your chances from 5% to 10%. You know, so it's very the particulars and so on. Keith says, if traveling long distance regularly is difficult due to disability, is clinical psychology not the best route to pursue? I would say that they would make just allowances for that, Keith. Don't be put off by that, right? They're not going to enforce you to travel long distance if that is incompatible with a disability, okay? And then Maria, would volunteering as a Samaritan or crisis counsellor be enough as experience for a doctorate? Probably not. If it was Samaritans and your degree. Crisis counsellor, I'd need to know specifically what that was involved with. But again, it wouldn't go against you. Obviously, it would increase your chances, but not so that I would say you've got a very good chance of getting in with, as it were, with that being your offer. Can you tell us again, Alison says, the likely annual cost for a doctorate in counselling psychology? It was a bit rushed. Yeah, I know it was a bit rushed. One of the problems is that it's difficult to work out, you know, because you've got so many extras like your supervision and your therapy and so on. The annual cost, I think it was around 6,000 a year for 3 years for full time. That's what's your thought on Lancaster University admission? I believe they have a different process to others. They were one of the first who used the online SIFT, and it might be that they've sort of tightened up on that. Look it up on the Google the clearinghouse. They'll give you the details of their process and the other 29. I don't know all the different admission procedures. Right. No, Samaritans cannot act as counsellors, says Vanessa. I know. I worked with the Samaritans rather, for 30 years. It's not. They say it's not therapy. It's not counselling. It is befriending. So that, in a sense, would go against the notion. But it would still be that you've shown commitment. You've shown and so on. And then Sarah Thomas says, I'd like to work in a perinatal field. Would counselling, psychology, clinical psychology, or health psychology be the best doctorate to go for? I think probably it depends what you wanted to do in the perinatal field. All of them, in principle, could be good and could be good. Health psychology, it would have to be a practitioner health psychology. Remember, some health psychology doctorates and maybe PhDs and masters are actually about research in health psychology, sort of epidemiology and so on. They are not training for
So I've dropped
work,
the
as it
the
were.
bar
So
on
be
one more
careful with
question,
that.
Neil, and the last one
There
that we
we
had was
go.
aside. Let me just skip back up to it. It was aside from AP roles at PWP, are there any good experience roles to look into?
Those are the standard ones, I'm afraid. But then there are so many other in terms of the voluntary sector and so on. I mean, the ideal thing is where you're working as a sort of, as a supervised sort of psychology, it's almost like technician, but working with clients. Client facing is the important thing. More than that, it's also if you can actually be in a team in which there is clinical psychology, and if you can be actually supervised in your work by a clinical psychologist, that's absolutely
Mm.
that's the hitting the nail on the head. I
Mhm.
wonder, David, before we go, I know we're finishing now, if I can just show one last slide, if I may. Um, sorry, I've got the wrong thing. There we are. There we go. Can I just sort of advertise something I've been working on for the last 2 months now? I'm very interested in there we go. I'm very interested in getting psychology out there. I mean, the benefits of psychology, therapy, and so on, out to lots and lots of people. And I've developed over the last few years various psychoeducation courses and so on, one of which is called Activate Your Life. It's based on ACT, which is acceptance and commitment therapy. And I was asked, because it was happening in the community, I trained 200 people to deliver this across Wales. It can't now go on because it's in the community. And then Public Health Wales asked me if I would develop a version of it for filming. So it's basically therapy online, free therapy online, not one-to-one, obviously, but a general psychoeducation approach. And it's ready now. It's available in English. It's not available yet, but it will be available in 3 weeks' time on the Public Health Wales website. There is I don't know why it's changed colour, but there is actually a web address there. And if you click on that on the day, not before the end of this month, it will be available. It's 45-minute films plus a lot of downloadable material. It's mindfulness based, but it's lots more than mindfulness. And it's called Activate Your Life. We want a lot of people to access it from really all over the world, but it's obviously funded by the Welsh Public Health Wales. I will put that on because it's difficult to read, I think, for you. For some reason, it's changed colour. I'll put it on Ask Fred and the OOPS website if you're interested, and I hope that you'll have a look at it. I mean, it counts, I guess, as a little bit of experience of what can be offered by clinical psychologists, because clinical psychologists are going to have to work differently from now on. I think the COVID thing, the pandemic, has been a terrible business. But there will, I think, be some silver linings, some things that will come